A recent Reuters Ipsos poll reveals a startling lack of trust in the Trump administration's vaccine policies, with only a quarter of Americans believing these decisions are scientifically sound. This is a controversial stance, especially considering the administration's historic vaccination drive during Trump's presidency. The poll shows that a mere 24% of respondents, including a small fraction of Democrats and nearly half of Republicans, think the new federal vaccine recommendations are based on science. The significant 48% believe otherwise, with the remaining unsure or choosing not to answer. The administration's top health official, Robert F. Kennedy Jr., has caused an upheaval in the federal immunization process. The FDA's recent decision to narrow COVID-19 vaccine eligibility to adults over 65 and those with health risks, along with Kennedy's firing of CDC head Susan Monterez and the entire CDC's Advisory Committee on Immunization Practices, has raised concerns. A new committee is set to meet soon, potentially voting on recommendations for hepatitis B, measles, mumps, rubella, varicella, and RSV vaccines. Many Americans, especially Democrats, fear that the Trump administration will further reduce federal support for vaccines. When asked about their concerns for children's future vaccine access, 48% of respondents expressed worry, with Democrats being particularly anxious. 4 out of 5 Democrats, 1 in 5 Republicans, and about half of independents share these concerns. The vaccine debate is not just a federal issue. It's playing out in state capitals too. Republican-led Florida plans to end public school vaccination mandates, while Democratic states intend to make their own vaccine recommendations, differing from federal guidelines. This Reuters Ipsos poll surveyed 1,084 U.S. adults and had a 3% margin of error for all respondents and a 6% margin for Republicans and Democrats. The question remains, should we trust the Trump administration's vaccine policies, or are they prioritizing political agendas over scientific evidence? What are your thoughts on this controversial issue?